Pelvic health physical therapy. Pelvic health refers to the overall well-being and proper functioning of the pelvic region, which includes the pelvic floor muscles, bladder, bowel, and reproductive organs. The pelvic floor muscles are a group of muscles that provide support to the pelvic organs and play a vital role in bladder and bowel control, sexual function, and childbirth. Pelvic health issues can arise in both men and women at any age and may include conditions such as urinary incontinence, pelvic pain, pelvic organ prolapse, sexual dysfunction, and bowel dysfunction. It is also recommended to seek medical attention if you experience symptoms related to pelvic health, such as urinary incontinence or pelvic pain, as early diagnosis and treatment can prevent the condition from worsening and improve quality of life. Pelvic health physical therapy is a specialized type of physical therapy that focuses on the treatment of conditions related to the pelvic floor muscles and structures. The pelvic floor muscles are a group of muscles that support the pelvic organs, including the bladder, uterus, and rectum. Pelvic health physical therapists work with both men and women to address a wide range of conditions, including urinary incontinence, pelvic pain, pelvic organ prolapse, and sexual dysfunction. During a pelvic health physical therapy session, the therapist will perform a thorough evaluation of the pelvic region and develop a customized treatment plan based on the individual's needs. Treatment may involve exercises to strengthen or relax the pelvic floor muscles, manual therapy techniques, biofeedback, and behavioral modifications. A pelvic health physical therapist is a licensed healthcare professional who specializes in the evaluation and treatment of conditions related to the pelvic floor muscles and structures. Pelvic health physical therapists work with both men and women of all ages and stages of life, including pregnancy and postpartum, menopause, and aging. They address a wide range of conditions, such as urinary incontinence, pelvic pain, pelvic organ prolapse, sexual dysfunction, and bowel dysfunction. The pelvic floor muscles are a group of muscles that support the pelvic organs, including the bladder, uterus, and rectum. Pelvic floor exercises can be beneficial for both men and women, particularly those who are experiencing urinary incontinence, pelvic organ prolapse, or sexual dysfunction. Strengthening the pelvic floor muscles through exercises can improve bladder and bowel control, reduce pelvic pain, and improve sexual function. It is important to note that proper technique is crucial for effective pelvic floor exercises. Working with a pelvic health physical therapist can ensure that you are performing the exercises correctly and targeting the appropriate muscles. If you are having difficulty identifying your pelvic floor muscles, you can also ask a pelvic health physical therapist for guidance. Pelvic floor exercises, also known as Kegel exercises, are recommended for pregnant women to help prepare for childbirth and to aid in postpartum recovery. During pregnancy, the weight of the growing uterus can weaken the pelvic floor muscles, leading to urinary incontinence and other pelvic floor dysfunction. Performing pelvic floor exercises during pregnancy can help strengthen these muscles, improve bladder control, and potentially reduce the risk of pelvic organ prolapse. To perform pelvic floor exercises during pregnancy, follow the same steps as described earlier, such as identifying the pelvic floor muscles and performing contractions and relaxations. It is recommended to speak with your healthcare provider or a pelvic health physical therapist for guidance on how to properly perform pelvic floor exercises during pregnancy and to determine a safe and effective exercise routine based on your individual needs. Visit our websites and social media.